Hi there and welcome to DocTalk. We're sure glad you joined us today. We're going to have a great show. We're going to talk about pinkeye and cattle. My guest today is Dr. Matt Miesner, and he's an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. It's bound to be a great show. Stay tuned.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Matt, welcome to the show.
Glad to be here again.
Well, it's always a pleasure to have you here. And folks, Dr. Matt Miesner is a associate clinical professor here at the Veterinary Health Center, and he is boarded in large animal internal medicine. And Matt, we're going to talk about something that's very common in cattle. It's something we see every summer, pinkeye.
Right.
And let's start out discussing, what are some of the things that causes pinkeye?
Sure, that's kind of, as we discussed before, it's kind of becoming a hot topic about this time of year is pink eyes and problems with cattle in their eye. And pink eye is probably one of the more common ones that we see, and it's an infectious problem of the eye. And actually, there are some specific bacteria that we talk about that cause the infection. But what we find is that we have a lot of other players in the environment that come in to aid them bugs. And this time of year, those things are coming about. Sunshine and dust and things like that.
It's kind of like when we talk to students, tell them there's two reasons animals get sick, either an overwhelming dose of a pathogen or a suppressed immune system. And this is really one of those that is an example of that.
Exactly. Yeah. I mean, in the specific bugs that we talk about causing it, one being the Moraxella bovis, and you'll see that in a lot of vaccines and whatnot. We'll see that bug, and it can cause problems, but it usually needs something to help it get a toehold, and something disrupts the eye or their immune system's poor, and then all of a sudden we start to see this type of infection show up, and it can be pretty devastating and just run wild through a herd.
So when we start to talk about some of the different things that, we talk about Moraxella bovis and some of the infectious agents, what are some of the non-infectious agents that can help set up pinkeye or cause something like pinkeye?
Irritants. So an irritant such as dust, grass-awns, sometimes composted bedding, sunlight, anything to irritate the surface of the eye or that cornea allows that bacteria that sometimes can be on the eye normally just grab a toehold and then cause this horrendous infection.
What about flies?
Flies. Yeah, and flies are irritating. Not only do they disrupt the eye and scratch it up, but then they'll grab it and go right straight to the next one, so they can carry the...
They can carry. Yeah. And we see that with foodborne pathogens like E. coli with flies transmission, and so...
Right.
So they could actually carry the bacteria from one animal to the other.
Yeah, that's right. Some of the way we get these massive spreads through a herd when we have an outbreak is flies and fly control. And they're irritating, and they're just nasty little bugs.
Yeah. Well, I think it's important to understand the bugs. I think it's important to understand the irritants. When we come back from the break, let's jump in and start talking about how we diagnose some of these problems and move forward with pinkeye.
Great.
You're watching DocTalk. We're glad you joined us. We'll be back in a moment.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This is Eric Stonestreet, and as many of you know, I love my home state of Kansas. In March, Kansas ranchers lost homes, equipment, and thousands of cattle from the largest wildfires in the state's history. Imagine losing all you have in a fire. Not just your house, but your livelihood. Ranchers are beginning to rebuild, but it will take years and tens of millions of dollars to build back herds, fences, and other infrastructure. Today, I'm asking you to help. Donate what you can and show your support to the ranchers of Kansas. Simply go to kansasfires.com. Your donation is tax deductible and will go to those who need it the most.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Welcome back to DocTalk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Matt Miesner, who is an associate clinical professor here at the Veterinary Health Center, and he's also a boarded large animal internal medicine specialist. And Matt, we're talking about what causes pink eye. Now let's get back to, and a lot of people can diagnose or have seen pink eye cases, but let's go through what you see as kind of the clinical signs first of pink eye and different levels of severity.
Well, and we certainly see a lot of cattle sent in with a white eye that may or may not turn out to be pink eye. But the biggest thing about pink eyes, we'll see these kind of very nice centered looking like scars right in the middle of the eye, and they really rapidly spread. The big thing about pink eyes is very painful, so they're tearing a lot, and there's a lot of watering eyes and squinting and trying to stay out of the sun. And then it'll get to where it almost looks kind of abscessed or infected, where you have this kind of white area that kind of spreads across the eye. The surrounding portion of that eye just gets really irritated and angry, and it's very painful. And so at that point, did we get a sticker in it? And there's still a sticker in it.
Right.
Or are we dealing with a pink eye problem that could be an outbreak or kind of some situation that we could do?
You see how these cases can manifest, and some of them get a little bitty scar, and some of them get that pop eye, and how is there anything to the severity? Is it more of a calf by calf situation, or?
I think you get back to where we talked about before. We get overwhelming dose and individual immune system, and so a lot of their immunity to fight this thing off is in their tears, and some have a more specific immunity to that bug, and these bugs can change rapidly even within an outbreak, to where that immunity that's on that individual calf may not be totally effective, and so we'll see some of them that just have massive infections, and others seem to be status quo for a little bit longer, but. Yeah, there's quite a bit of individual variation.
And we always recommend people work with their local practitioner. What are some of the things practitioners might do to get a better diagnosis of what's going on? Maybe of course we do the clinical exam and the physical exam, but what are some things diagnostically that we might do? Well,
if we're looking for a specific bug, they can culture it. We can take swabs, we can send them to the diagnostic lab, and they can tell us what bacteria, what bug is there, and is it one of these that are pink eye bugs. But I always tell people too to really, every single one that we swab, take your finger and sweep it through the back of the eye and look for grass-ons.
Yeah.
So that's part of the diagnosis is, we're going to find a bug, but we're also going to try to make some other management tools to prevent the risk factors. And hey, we got a bunch of grass-ons. We better get these things out, and then we'll figure out what bug we got. So, a bunch of different ways to do that.
So it can be, what are some of the other differentials that might be on your list?
Oh, we've seen viral things like IBRs and BVDs and, just overall traumas. And in older cattle, we might see some that think they're cancer eyes or different situations, some odd situations. And I've seen white eyes where they were just bacterial infections in the eye. They weren't an eye infection. So there's several different things it could be, but it's pretty clear. Yeah, it's pretty clear for the most part.
When we come back from the break, we're going to talk with Dr. Miesner more, and we're going to talk about how to treat those pink eye cases. You're watching DocTalk. We're glad you joined us, and we'll see you in a minute.
Next time you see a beautiful field of corn, reach out and thank the farmers who work tirelessly to raise corn for livestock feed, renewable fuels, and exports to feed a growing world population. The farmers on the Kansas Corn Commission work for Kansas Corn with grower-funded checkoff dollars that support foreign and domestic market development, research, promotion, and education to expand opportunities for Kansas farmers. To learn more, visit kscorn.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica Inc.
Hello folks, Dr. Nels Lindberg here with Production Animal Consultation and Animal Medical Center out of Great Bend, Kansas. Today's BQA Tip of the Day, we're thinking about handling our cows for this fall. Everyone's getting done with fall harvest and thinking about handling their cows and getting them preg checked, moving them off of grass onto whatever residues or pastures they may be moving them to. When we do those things, we think about stress on those cows, and we want to do everything we can possibly do to minimize those stresses. And so cattle handling those cows is a very important thing to think about. When we move them off pasture, gather them, move them to another pasture, move them to another residue, or as we're bringing them in to get them preg checked, we just want to do all we can to minimize hot shot use, cattle prod use, all those things. And it's about positioning and anticipation and pressure and release and focal point on that eye. And we just have to do those things to do the right thing for the cattle, which our people demand that we do the best we can in terms of animal welfare. And there's nobody cares more about animal welfare than those of us doing it. So keep it forefront in your mind, think about it, do it, and keep at it.
We do business with Blueville because of the quality of their work. It is excellent quality, and because they make a commitment to their customers.
We enjoy the benefits of hiring a good company to help us maintain this home.
We will always do business with Blueville. We have for many, many years, and there's no reason for us to look for any other service.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hi there and welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner. And Dr. Miesner is a boarded large animal internal medicine specialist here at the Veterinary Health Center. He's also an associate clinical professor at Kansas State University. We've been talking about Pinkeye, and we're going to talk about treatment. And before we jump into it, the one thing we always recommend on DocTalk is that they have a valid veterinary client-patient relationship and that they work with their veterinarian to get a proper diagnosis and plan of attack on treatments. Because as we discussed during the break, there's more than one way to skin a cat on Pinkeye treatment.
Absolutely, yeah. And I don't really think there's a wrong way to treat them. I think that you're going to find several different methods, and what works for your veterinarian works for your veterinarian because it's worked for your veterinarian. So right. If that's where we want to go, we can stay up with current thoughts and current trends on bugs and antibiotic sensitivities, and whenever they get that chance to culture and do a sensitivity, they might pick a specific antibiotic this time, whereas they might pick another one the next time. Just depends what they're going to do. It's nice to have that, but so an antibiotic is one of those things that we like to have direction on, but we don't always. So we may just kind of randomly pick one initially and see if it's going to work. Next thing, I've seen procedures where the biggest thing is getting them out of the sun, protecting that eye. It hurts as long as that sun's beating on them, so we may glue a patch on.
Get the irritants, the sun, the flies, the dust, get it off of there.
Protect them. So I've seen patch glued on. I mean, there was a time when I was cutting out old Levi's to make patches that we could glue on the eye. It also prevents flies from getting on that and going to the next one. I've seen other situations where we're injecting penicillin near around the eye and then covering it with a suture. You know, so that's another method that you might have seen, or any of the people out there might have seen their veterinarians do. Depends on facilities, what you have to work with, where you're at, and how you're going to treat those. But it's nice to get on it and have a direction and stick with it, and make some scientific choices through the course.
Any preference for you, systemic versus the localized injection of antibiotics?
Well, everything that I've read has shown that either a systemic antibiotic, there's a couple mentioned, or the locals, the duration of the disease is about the same. You know, and most of the big studies looking at overall cure rates and time, they're all about the same. You know, one thing I do advocate is an anti-inflammatory, though, because those eyes hurt. You know,
what would be some examples of anti-inflammatories that you?
Flunixin, Banamine, and I've even seen dexamethasone or steroids used, depending on how bad they are.
Just to help with the pain of the eye and reduce the inflammation around that cornea.
Right, and some of them get bad enough that they get beyond treatment, and then at that point it's probably a good idea to take the eye out. So we've had to go that far too.
So antibiotic, systemic or local, get an anti-inflammatory, and if it gets bad enough, we may have to remove the eye.
Right. Yep.
Great. We're going to take a break. When we come back from the break, we're going to talk about ways to prevent pink eye from occurring in your herd. Dr. Matt Miesner has joined me today. You're watching DocTalk. We're sure glad you joined us. We'll be back in a minute.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help? How can we help?
Did you know long-range planning through the checkoff can help keep your business profitable? To successfully pass on cattle operations from one generation to the next, it's important to promote beef and keep farms and ranches profitable. Your beef checkoff helps do that.
I'm Will Townsend. I'm part of Townsend Ranch. It's a ranch my grandparents started. They actually raised their family and started growing their cow herd right here. I would be the third generation on the ranch, and daughter and expecting a son would be the fourth generation on the ranch. The beef checkoff has done a lot of things for the beef industry. The biggest thing, when you look at it from a 30,000 foot view, is that it's brought a lot of different segments together to promote beef. And I don't think that is done easily. I think that's a very big feat.
And when the checkoff dollar is collected, the money is spent for educational purposes. A lot of them are national programs, and the state takes the national programs and runs with them. So not only do our own local producers benefit from that, but nationally.
Yes, I really like the research and development aspect of the beef checkoff. Adding value and development of new products, new beef cuts, things like the flat iron steak. That's a huge deal, again, that with a segmented industry probably wouldn't have been done without the beef checkoff. And then both domestic and foreign marketing is something that really probably wouldn't be done by different segments of the industry without them all coming together. Again, that probably wouldn't have been done without the beef checkoff.
And I don't know who would promote our product if we who are raising it don't promote it ourselves.
Soil is the life of a farm, and for 25 years, SureCrop Liquid Crop Nutrition has helped growers produce abundant quality crops while preserving and improving the soils they steward. SureCrop offers complete soil and plant analysis with cropping recommendations, delivery direct to your on-farm storage, and quality crop nutrition custom blended for your field. Choose SureCrop for the assurance of excellence for your soil. Call today or visit their website for more information.
I'm Rexanne Struve, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014, and after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis, I have joints, really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people, because this is a phenomenal place to have this done.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner from the Veterinary Health Center. He's a boarded large animal internal medicine specialist, and he is an associate clinical professor. And we have been talking about pinkeye. And it's something that happens in all the cow herds, and we've gone through the causes, the bugs, the ways to diagnose it, treatments, and now we're going to talk about prevention. And I told Matt during the break, I said we better start out with vaccine, because that's the one everybody's going to want to know about right off the bat. And what are some of the general thoughts or opinions on vaccinations?
I think that the general thoughts is, they wouldn't be there if they didn't have some benefit, and I believe they do. And then there's also the vaccines we have that we can culture that bug. You can send it into a lab and have that bug made into a vaccine, meaning an autogenous vaccine. And I've heard all of those used. And then on my side, I kind of look at the evidence and try to figure out, is it a cure-all? No, it's one of these bugs that can change so readily within an outbreak from year to year, from herd to herd. There's a couple of different bugs that they're actually questioning now. So it's pretty wide. It can help. I think what we've pretty much consensus is if you use your vaccine and it's not really cutting the mustard, you might spend more of that money on some other preventive measures, which we get into secondly. But the vaccines, they're there. They're a good tool. Use them if they're not working. We need to kind of focus on the other 5 or 6 different problems that
might make a little bigger difference.
Because treatment is a nightmare. It's one of those, when you get into a big mess, it is a lot of labor and a lot of work and a lot of frustration. So prevention is the big key here.
What are some of the other, we talked about the irritants. What are some of the other things that we might do to kind of prevent?
Sure. So, the irritants being grass-awns and dust. So we can limit dust if we have the ability to keep moisture on the ground in pens. We can mow the seed heads off the pastures to limit all the grass-awns that could get in there and irritate the eye. We can have shades just to keep that under control. UV light, fly tags, different things, fly preventions. Those are huge. And if we can get all those added up in an efficient way, I think we can limit it a lot. I have clients that will start mowing pastures here to limit their exposure and kind of irritants for pinkeye. They've had it in the past, and that's one thing that works to limit it. And so,
well, I've even seen some deals on fly control that'll be coming out. That fly control delivered in a paintball gun.
Oh,
yeah, yeah. So could be kind of fun. A way to get rid of flies in here.
And then lastly, I think good nutrition. Good strong nutrition, keep them healthy, keep their immune system going. Trace minerals and overall energy. I think we'll keep them healthy.
Well, appreciate you being here today.
Sure.
Appreciate you joining us too. If you want to know more about what Dr. Miesner and I do here at the College of Veterinary Medicine at Kansas State University, you can find us on the web at www.vet.ksu.edu. And remember, we always recommend that you work with your local practitioner. You've been watching DocTalk today. We've been talking about pinkeye. We're really glad you joined us. I'm Dr. Dan Thompson, here from the College of Veterinary Medicine at Kansas State University. I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. To see this show and past episodes of Ag AM in Kansas, go online to agaminkansas.com.